Hi, welcome to the Destin Business Forum, brought to you by the Destin Area Chamber of Commerce. I'm your host, Amy Perry, and we have today two wonderful ladies from SimpleHR and SimpleHIRE. From SimpleHIRE, you are Sarah Blessinger, correct?
Hi.
And you are staffing administrator. From SimpleHR, Shannon Kosha, you are a certified healthcare reform specialist and SimpleHR benefits administrator.
That's correct.
That is a mouthful, and I'm going to ask you about the certification, but first I want to talk about SimpleHIRE. What is SimpleHIRE?
We are a premier staffing firm in the Destin area, specializing in professional positions in the administrative, hospitality, finance, medical, and legal fields.
Okay, and so if somebody in one of those areas needs an employee, what do?
They give us a call. We kind of go through an interview process with them. We want to find the right candidate for them. So I sit down and ask, what types of skills, background, education they're looking for in this position. I like to know kind of the personality traits that they're looking for, who has been successful in that position before. So we get a good idea of exactly who we can refer to them so that we find the right fit the first time.
Okay, and when you find a candidate that you think would be successful, obviously you're going to interview them and then you send them to the firm, the medical facility, whatever, to interview that person.
Yep.
All right, so I find somebody that I think is going to work. Then what happens? Do they work for me for a probationary period of time? Or?
You have a couple of options. You can do a direct hire where we would refer qualified candidates to you. You interview them, you decide they're going to be the right fit, and you can hire them on directly. The other option is if you've maybe been burned in that area and you want to give them a trial basis, you again, we refer qualified candidates to you, you interview them, you decide they're the right person, you send them back to me, they go on our payroll for the first 90 days. It gives you and the candidate an opportunity to test each other out and see if it's going to be a good fit.
Okay, and you can do either one. No pressure to do. So your focus in 2014, I hear, is going to be a little different than it has been in the past years. What is that all about?
Well, our original focus has always been to be that premier staffing firm in the professional fields. It just seems in the past couple of years we've kind of strayed from that vision, really taking on different kinds of positions from any industry. And in 2014, we've done our strategic plan. We've studied the staffing industry, decided we really need to get back to that niche market. So that's what our focus is.
I think that is a great market because as an employer in the legal field, it is sometimes hard. If you list a job, you may get a lot of resumes, but they may not have the experience, the qualifications that you need. And that, as you know, takes time away from, doing the legal work that I need to do. So to have somebody doing that groundwork for you, speaking from personal experience, I think it's a great thing. All right, so we're going to turn now to everybody's favorite topic, the Affordable Care Act. Yes. But first, it says that you are a certified healthcare reform specialist. What do you have to do to become the certified healthcare reform specialist?
There's a national course that you can take. It's actually, you can either travel to Las Vegas and take the full course there.
And I'm sure Bill Lindsley let you do that,
absolutely.
Right? All right, just making sure.
The other option is to do it online, which works a lot easier with my schedule.
Sure.
So just doing that on the weekends, taking the course, and then following the course, there's an exam pretty lengthy exam that you do have to take and successfully pass, of course.
Which you did because you are a certified healthcare reform specialist. So you know all about the Affordable Care Act.
Yes, and yes, I stay abreast, and with the certification as well, you get constant updates from the legislation, any new laws passing, any new regulations, any updates. I'm constantly being informed with those and providing those updates to our clients.
To your clients. And I know I get some updates, and it's just, you must get one every day. So tell me about the individual mandate. I hear there's some extension of the deadline.
That's correct. The individual mandate deadline has been extended to March 31st. This enables individuals to enroll in health insurance coverage through the insurance marketplaces under the Affordable Care Act. Okay. As long as an individual enrolls during this open enrollment period and has coverage by May 1st, he or she will not face a penalty for not having coverage. The previous deadline was January 1st, and if individuals did not have coverage by January 1 deadline, however, they've now extended it with the issues that I'm sure we've all heard about with the website. So it's been extended.
So can the individual get any kind of coverage, or are they, I know the employer has to provide a certain type of coverage. Does the individual have to get a certain type of coverage in order not to be penalized?
That's correct, yes. Individuals at least have to have a plan that covers minimum essential benefits. So minimum requirements under the Affordable Care Act, an individual has to have a plan that offers that. The plans in the marketplaces all offer that coverage. So if an employer does not offer coverage and an individual is going to the marketplace, they have a plan that meets the minimum requirement.
So I'm thinking of a scenario where an individual works for let's say they work for a law firm, a small law firm, that is under, what's the criteria, 50 employees?
That's correct.
So if you're under 50 employees, which I'm sure probably all firms in this area would be under 50 employees, and they are offering a plan right now that doesn't quite fit, is the individual going to be penalized if they go with their employer's plan as opposed to getting something in the marketplace?
The individual would not be penalized. The employer coming in 2015 would be penalized.
So this year's kind of a grace year
correct.
For everybody to figure out what's going on?
Yes.
So in 2014, are the employers required to offer a plan that complies with the ACA, or that doesn't happen until 2015?
That's correct. The initial rollout for the employer mandate was January 1, 2014. However, that has been delayed 1 year. So now the employer mandate is January 1, 2015. And with that, a lot of employers, when the delay happened, kind of took a sigh of relief, were able to take a step back.
Well, you didn't know what was going on,
right?
Because everybody was saying, well, maybe you should renew early at slightly greater rates, but it was an unknown.
Right.
Renew now, it's going to go up a little bit, or it may go up a lot January 1.
Right.
So, so do you think, and I know I'm asking you to project into the future, and a lot of people can't do that, but do you think that this year everybody will be able to get their act together and kind of know at least a little more about what's going to happen in 2015?
That's what we're really hoping for. With the additional year that employers have to do the research, call me, call SimpleHR, even if they're not clients, call their brokers and just really get a firm grasp on what they need to do and to really fully understand the law and the mandates under it. I think that this additional year is a great benefit. As you mentioned before, the threshold is 50 employees. So 2014 is the year that employers really need to take a look at their staff and decide, do I want to pay or play? Right. Do I want, if I'm over that 50, do I want to unfortunately reduce my workforce so that I'm under that 50 so that I don't have to comply? Or do they want to grow their workforce so, they do go over that 50, and then are they going to offer health insurance coverage, or are they just going to pay a penalty for not offering health insurance coverage?
Right. It's difficult as an employer figuring all that out. And you do that at SimpleHR.
Yes.
You take care of all that. You're telling your clients what's going on. There's also something that the employee has to get fairly soon after employment.
Yes.
Do you provide that?
Yes. There's October 1st, there was a requirement that came out where all employees have to receive marketplace notices. These show the employees their right to obtain health insurance through the government marketplaces. With that deadline of October 1st, that was for existing employees. Any new employees that come on after that October 1st So any new employees now going forward, they have to receive that notice no later than 14 days following employment.
Wow, that's not very long.
That's correct.
So I'm sure you take care of that for all of your clients, right?
All of our clients, their employees have to complete our post-hire employment packet, and we have that notice in there just to ensure that all of our clients are staying in compliance with their employees receiving those notices.
Okay. And we sort of jumped right into the Affordable Care Act, but what else, just in general, does SimpleHR do for those 4 people that don't know?
We do payroll services for our employees, our clients, HR services, benefits. Aside from the Affordable Care Act, we also offer a wide range of benefit packages for our clients. Again, the payroll services, W-2 printing, we just
that's nice, yeah.
did that this past weekend. So
if somebody has SimpleHR or they're looking about making the switch, I would think one thing that they would be a little bit nervous about is, okay, if I take all my employees in my office and I put them over to SimpleHR, do I still have control? Can I manage them still? Or is that what Shannon's going to be doing now?
That's a great question. Essentially, when you sign up with SimpleHR, your employees come under our EIN number. So they essentially become our employees for just that purpose. However, the client still
just
has...
for tax purposes?
That's correct.
Okay.
The client still has direction and control of all of their employees. They still do the hiring, the firing. In terms of the Affordable Care Act, it falls to the client location. So where the direction and control comes from is where the Affordable Care Act is going into play as well.
Okay, so I can't have employees that that fall under SimpleHR and then say, wait a minute, they have to comply, not with the Affordable Care Act, not me.
That's correct.
That doesn't work.
The on-site employer who...
All right, well, I was thinking. So that's a benefit. I still get to manage. Mm-hmm. When I think of HR, I think of, partly I think of if somebody's having a problem with their boss, and they, who do they go up if you are supposed to go over their head and that's the boss? Can they go to SimpleHR and say,
Absolutely.
Look, I'm having this problem. I know they're really the management side of it and your payroll, but can you get involved and...
Oh, absolutely.
Okay.
Absolutely. We encourage employees, to come to us when they're having issues like that they may or may not be able to speak to their boss about in fear of retaliation.
Sure.
So we do...
Or maybe not even retaliation, but just, it seems like it would be awkward.
Sure.
To talk to, the boss. So you can do that. All right, I see we're out of time. This flew by pretty quickly. Is there anything that I failed to ask you that you want to talk about?
I just wanted to also point out the services under the Affordable Care Act with SimpleHIRE, with the seasonal employees in our industry. The season is pretty much March through September, so that's about 6 months. Whereas under the Affordable Care Act, you can only have seasonal employees on for 120 days, which comes out to be about 4 months.
Okay.
So using SimpleHIRE's staffing service and their 90-day trial period,
you can
kind of
manage that.
Right.
That's a really good point. I didn't think about that. I'm sure a lot of people are going to be calling.
Yes, we hope so.
All right. Well, thank you for joining me. I feel a little bit smarter. I actually feel a lot smarter. We'll be back.